talk about lupus. Okay, lupus is an autoimmune skin disease, which we will talk about in further. Lupus is a disease that occurs when your body's immune system attacks your own tissues and organs, which is an autoimmune disease. Inflammation caused by lupus can direct many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs. Lupus can be difficult to diagnose because its signs and symptoms often mimic those of other minor illnesses. The most distinctive sign of lupus is a facial rash that resembles the wings of a butterfly unfolding across both cheeks. Occurs in many, but not all cases of lupus. Some people are born with a tendency toward developing lupus, which may be triggered by infections, certain drugs, or even sunlight. While there is no cure for lupus, treatments can help control symptoms. No two cases of lupus are exactly alike. Signs and symptoms may come on suddenly or develop slowly, may be mild or severe, and may be temporary or permanent. Most people with lupus have mild disease characterized by episodes called flares, which is when signs and symptoms get worse for a while, then improve or even disappear completely for a time. The signs and symptoms of lupus that you experience will depend on which body systems are affected by the disease. The most common signs and symptoms include fatigue, fever, joint pain, stiffness and swelling, butterfly-shaped rash on the face that covers the cheeks and bridge of the nose, or rashes elsewhere on the body, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, and headaches, confusions, and memory loss. See your doctor if you develop an unexplained rash, ongoing fever, persistent aching, or fatigue. As an autoimmune disease, lupus occurs when your immune system attacks healthy tissue in your body. It's likely that lupus results from a combination of genetics and your environment. It appears that people with an inherited predisposition for lupus may develop the disease when they come into contact with something in the environment that can trigger lupus. The cause of lupus is, in most cases, unknown. Some potential triggers include sunlight. As many other diseases, sunlight is a way that increases your risk of of many diseases. Exposure to the sun may bring on lupus skin lesions or trigger an internal response or in susceptible people. Infections. Having an infection can initiate lupus or cause a relapse in some people. And medications. Lupus can be triggered by certain types of blood pressure medications, anti-seizure medications, and antibiotics. People who have drug-induced lupus usually get better when they stop taking the medication. Rarely, symptoms may persist even after the drug is stopped. Factors that may increase your risk of lupus include gender. Lupus is more common in women, and age. Although lupus affects people of all ages, it's most often diagnosed between the ages of 15 and 45. And race. Lupus is more common in African Americans, Hispanics, and Asian Americans. Inflammation caused by lupus can affect many areas of your body, including your kidneys. Lupus can cause serious kidney damage, and kidney failure is one of the leading causes of death among people with lupus. Brain and central nervous system. If your brain is affected by lupus, you may experience headaches, dizziness, behavior changes, vision problems, and even strokes or seizures. Many people with lupus experience memory problems and may have difficulty expressing their thoughts. Blood and blood vessels. Lupus may lead to blood problems, including a reduced number of healthy red blood cells and an increased risk of bleeding or blood clotting. It can also cause inflammation of the blood vessels. Lungs. Having lupus increases your chance of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into lungs and pneumonia also are possible. And heart. Lupus can cause inflammation of your heart muscle, your arteries, or heart membrane. The risk of cardiovascular disease and heart attacks increases greatly as well. Having lupus also increases your risk of infection. People with lupus are more vulnerable to infection because both the disease and its treatment can weaken the immune system. Cancer. Having lupus appears to increase the risk of cancer, however, the risk is small. Bone tissue death. This occurs when the blood supply to a bone declines, often leading to tiny breaks in the bone and eventually to the bone's collapse. Pregnancy complications. Women with lupus have an increased risk of miscarriage. Lupus increases the risk of high blood pressure during pregnancy and preterm birth. Diagnosing lupus is difficult because signs and symptoms vary considerably from person to person. Signs and symptoms of lupus may change over time and overlap with those of many other disorders. No one test can diagnose lupus. The combination of blood and urine tests, signs and symptoms, and physical examination findings leads to the diagnosis. Laboratory tests. Blood and urine tests may include complete blood count. This test measures the number of red blood cells, white blood cells, and platelets, as well as the amount of hemoglobin, which is a protein in red blood cells. Results may indicate you have anemia, which commonly occurs in lupus. A low white blood cell or platelet count may occur in lupus as well. Erythrocyte sedimentation rate. This blood test determines the rate at which red blood cells settle to the bottom of the tube in an hour. A faster than normal rate may indicate a systematic disease such as lupus. The sedimentation rate isn't specific for any one disease. It may be elevated if you have lupus, an infection, another inflammatory condition, or cancer. Kidney and liver assessment. Blood tests can assess how well your kidneys and liver are functioning. Lupus can affect these organs. Urinalysis. An examination of a sample of your urine may show an increased protein level of red blood cells in the urine, which may occur if lupus has affected your kidneys. Anti-nuclear antibody tests, ANA. A positive test for the presence of these antibodies produced by your immune system indicates a stimulated immune system. While most people with lupus have a positive ANA test, most people with a positive ANA test do not have lupus. If you test positive for ANA, your doctor may advise more specific antibody testing.
Imaging tests. If your doctor suspects that lupus is affecting your lungs or heart, he or she may suggest a chest X-ray and see what's wrong with your chest, an echocardiogram and see the activity of your heart. Both of them can lead to the diagnosis um, of lupus. Next slide. Biopsy. We talked about this before, where he where he takes the doctor takes a sample of your skin and tests it in the laboratory. Um, Lupus can also harm your kidneys in many different ways, and treatment can vary depending on the type of damage that occurred. In some cases, it's necessary to test a small sample of kidney tissue and determine what the best treatment might be. The sample may be obtained with a needle or through a small incision. So yeah, they just test a sample in the laboratory. Next slide. Treatment. Treatment for lupus depends on the signs and symptoms. Determining whether you should be treated and what medication are used requires a careful discussion of the benefits and risks with your doctor. As your signs and symptoms flare and subside, you and your doctor may find that you'll need to change medication or dosage. The medication most commonly used to control lupus includes non-steroidal anti-inflammatory drugs, over-the-counter NSAIDs such as naproxen sodium and ibuprofen may be used to treat pain, swelling, and fever associated with lupus. Stronger NSAIDs are available by prescription. Side effects of NSAIDs may include stomach bleeding, kidney problems, and an increased risk of heart problems. So they just anti-inflammatory drugs to treat the pain and swelling. Anti-malarial drugs, medication commonly used to treat malaria, affects the immune system and can help decrease the risk of lupus flares. Side effects can include stomach upset and very rarely damage to the retina of the eye. Regular eye exams are recommended when taking these medications. Next slide. Corticosteroids, prednisone, and other types of corticosteroids can counter inflammation of the lupus. High doses of steroids, such as methylprednisolone, are often used to control serious disease that involve the kidney and brain. Side effects might include weight gain, easy bruising, shining bones, high blood pressure, diabetes, and increased risk of infection. The risk of side effects increases with higher doses and long-term therapy. Immunosuppressants, drugs that suppress the immune system, may be helpful in serious cases of lupus. Potential side effects may include an increased risk of infection, liver damage, decreased fertility, and increased risk of cancer. Biologics, a different type of medication, also reduces lupus symptoms in some people. Side effects include nausea, diarrhea, and infections. Rarely worsen of depression can occur. Clinical trials, voclosporin has been shown to be effective in treating lupus. Other potential drugs to treat lupus are currently being studied, including abatacept, infrolumabs, and others. Lifestyle and home remedies that a person with lupus could do. Simple measures can help you prevent lupus flares, and should they occur, better cope with signs and symptoms you experience. Try to see a doctor regularly. Having regular checkups instead of only seeing your doctor when your symptoms worsen may help your doctor prevent flares. So the more you see the doctor, the better. Basically, they can treat them easier. Be sun smart. Ultraviolet light can trigger flares, so wearing protection and sunscreen can help in preventing lupus. Next slide. Get regular exercise. Exercise can help your bones strong, reduce your risk of heart attack, and promote general well-being. Being healthy in general helps in any disease. Don't smoke. Smoking increases your risk of cardiovascular disease and can worsen the effects of lupus. Eat a healthy diet, as I said, with getting regular exercise. Being healthy in general helps in preventing and treatment of any disease. So sometimes having a diet and controlling what you eat is really helpful. Ask your doctor if you need vitamin C and calcium supplements. Vitamin D and calcium supplements may be helpful with people that have been infected with lupus. Next slide. Alternative medicine. Sometimes people with lupus seek alternative and complementary medicine. There aren't any alternative therapies that have been shown to alter the course of lupus, although some may ease lupus of the symptoms of the disease. Discuss these treatments with your doctors before initiating them on your own. So before doing any alternative medicine, talk to the doctor before doing them because they might hurt and they might help. So it goes both ways. So consulting a doctor would be better. Next slide. These alternative medicines include DHEA, taking supplements containing this hormone, along with conventional treatment, may help reduce lupus flares. Fish oil supplements contain omega-3 fatty acids that may be beneficial for people with lupus. Acupuncture. This therapy uses tiny needles inserted just under the skin. It may help ease the muscle pain associated with lupus. Next slide. Coping and support. If you have lupus, you're likely to have a range of painful feelings about your condition, from fear to extreme frustration. So, and this is a lot very common in skin diseases, where it gets the brain. You feel depressed or self-conscious about them. So, what are the things that you could do to hopefully cope with the condition and continue? Um, Learn all you can about the disease, and knowing what all you can help in feeling better. Gathering support amongst your family and friends. Um, Self-explanatory. I don't think I need to read all this. Next slide. Um, Take time for yourself. Cope with stress in your life by taking time for yourself. Use that time to read, meditate, listen to music, or write in a journal. Find activities that calm and renew you. Connect with others who have lupus. Feeling relatable. Feeling having cases of that are being relatable can help in in the feelings and consequences that are there. Next slide.
Okay, here's the end of the presentation. Thanks for your attention.